Dr. Boehmer, thank you so much for taking the time to meet with us, and congratulations on your late breaker this morning.
Well, thank you so much. We're very excited about the results.
Yeah. So I wanted to start the interview by asking you if you could just summarize the results of the trial presented this morning.
Sure. So the benefits of MicroCore in decompensated heart failure, or BMAD trial, is a multi-center, multinational, prospective concurrent control clinical trial. It's not a randomized controlled clinical trial, and it has two arms. One arm is the control arm, where subjects were enrolled in the study. They receive a device to monitor for heart failure, but the physicians and patients did not have access to the data. On the other hand, the intervention group had the same enrollment criteria, but in their case, they had access to the data from the device through the physicians to share with the patients.
And can you summarize the findings?
Sure. So when the two groups were compared, it was a group of patients that were recently hospitalized for heart failure and looking for heart failure readmissions. There was a 38% reduction in heart failure rehospitalization in the intervention group compared to the control group. That adds up to an absolute value of 7%, or 1 in every 14 patients who would have been admitted to the hospital is now not readmitted to the hospital.
That's incredible. We all know that the timing post decompensation or hospitalization for heart failure is a very high risk time, and 30-day, 90-day readmissions are a key metric. So I think those findings are absolutely remarkable.
No, and that's the nice thing about this type of monitoring. It's a wearable patch, and it's applicable during a time of high risk, such as when somebody has recently been hospitalized for heart failure. And you can wear it until that risk is diminished, and then take the patch off and use your resources to help manage other patients.
I can imagine many ways in which this will be practice changing and field changing. We have the CardioMEMS, but of course that's an implanted device, which has its limitations. So could you summarize for us how, as a fellow in cardiology, should this be changing my practice?
Well, I think we're going to have a broader portfolio of options for monitoring patients with heart failure. Certainly, the CardioMEMS device monitoring PA pressures has the largest evidence base behind it and has demonstrated reductions in heart failure hospitalization. But that's a device that is long-term. So you're going to continue to monitor those patients throughout the course of their heart failure. Compare that to a wearable where you can put it on during a period of high risk and take it off, and you don't need to continually monitor that group of patients. That frees up resources that you're going to have to be able to manage the patients at high risk and not simply continue to manage the patients who have the device.
Yeah, that makes a lot of sense. One other follow-up question I have is, often with the wearable space, we see that there's an influx of data, and really the winners are those who can synthesize the data into actionable clinical insights for, time-constrained physicians. So can you talk a little bit about that point with the MicroCore?
That's a great question, and the MicroCore actually collects more data than the thoracic fluid index. Having said that, that was the sole parameter for the threshold in this trial. We have heart rate data, we have respiration data, we have activity data, we have nighttime posture data. How steep is your sleeping angle at night? People with P&D and orthopnea do sleep at a steeper angle. So we're going to get more information that then we can incorporate into this and maybe build a more robust risk metric to help clinicians and patients understand how this is working and how their heart failure condition is progressing.
Thank you so much. And thanks for watching. Please visit our YouTube channel at youtube.com/FitsOnTheGo for the full video. And please follow us at FitsOnTheGo on Twitter for more videos just like this.